Every year in the United States, hundreds of people die due to a severe allergic reaction called anaphylaxis. If you're having an anaphylactic reaction, paramedics may only have minutes to save your life.
Having trouble breathing?
It happens from an innocent bite of the wrong food.
I'm gonna take your blood pressure.
I need you to take a big deep breath. I know it's hard.
Or from the venom of a stinging insect.
What you need to do right now.
Or even the injection of a mistaken medication.
Dean, do you have any allergies to medicines?
The victim can become confused.
Turn your head to the
His
side.
airways constrict,
Side stack at 120.
and his blood pressure plummets.
All right, Dean.
And it's all due to allergies.
I've cheated death over 20 times.
And her eyes rolled in the back of her head and she fell off the chair.
My throat started closing, hives all over the place, and then the ambulance had to take me to the hospital.
They're talking about anaphylaxis, the most severe type of allergic reaction you can have, but it begins the same way as any allergy. When a foreign substance enters the body, sometimes the immune system makes a mistake. It senses danger and goes on the attack.
1, 2, 3.
This reaction causes allergic symptoms. Usually, they're mild, like sniffles or a rash. But when the allergic reaction goes out of control, the result is anaphylaxis.
Anaphylaxis is the catastrophe in allergy. So at its worst extreme, the patient loses consciousness, patient stops breathing due to severe airway obstruction, and it's a real medical emergency.
It took like one bite and I knew something was really wrong.
I ended up in the emergency room having a severe time breathing.
Anybody that's anaphylaxed will tell you that it feels like you're going to die.
Okay, so here's how it breaks down. You can be allergic to something you touch, like poison ivy. You can be allergic to something you eat, like peanuts or milk. You can be allergic to something that's injected, like penicillin or insect venom. But most commonly, you can be allergic to something you inhale, like pollen or even dust mites. So you think you've got allergies, but how do you know what you're allergic to? Well, to find that out, you need to take a trip to the allergist.
Today I'm visiting allergist Dr. Aidan Long. He's going to perform a test on me that identifies the exact substance a person is allergic to.
Nice to meet you. I'm Kat.
Have you ever had allergy testing before?
No, I'm a little nervous. Wow.
I'm just gonna wash your arm off. All we're gonna do is put little scratches on your arm.
How come you do it on the arm as opposed to like somewhere else on the body?
For convenience, really. It would probably react the same way wherever on the body you did it.
Oh, it's a pen. Okay.
Little pen. Just little marks on your arm so we know what's what.
Okay.
Now I get scratched. With each one, they put a small amount of allergen, the stuff that causes allergies, into my body.
Okay.
Thank you.
You're welcome.
Dr. Long tested me for the usual suspects. First, pollen, which are produced by flowering trees, grasses, and weeds. Next, microscopic seed-like spores produced by mold. Then dust mites, those nasty critters that live in our beds. And finally, pets like dogs and cats. It's not their fur we're allergic to, but a protein in their saliva. When an allergen enters the tissue, the allergic person's immune system thinks a dangerous substance is invading. First, immune cells called mast cells bind to the allergen. The mast cells then release a flood of chemicals, including histamine. The histamine causes blood vessels to dilate and become porous like a sieve, allowing fluid to leak out, inflaming the surrounding tissue. When that fluid leaks into your nasal passages, you get a runny nose, along with some aggravating itching and sneezing.
So what we have here is strongly positive reactions to
When the histamine leaks into your skin, you break out in hives. This is what a positive skin test looks like.
The size of that roughly correlates to the degree of allergic sensitivity.
Dr. Long can test me for hundreds and hundreds of different types of allergens. This precise test can determine the exact species of pollen or type of mold that someone is allergic to.
Wow, so is there anything showing up?
I don't think so. I think from an allergy point of view, we can give you a clean bill of health.
Okay.
Really, it's quite a phenomenal test. And if you realize that you're testing for a specific protein, in fact, a tiny fragment of that protein, it's a remarkable test in medicine. You can be that specific and that sensitive, virtually at the bedside or in the office. This is molecular testing right in the office. There's no other test in medicine that comes close to that, in my opinion.
Most people with allergies suffer from seasonal allergic rhinitis, more commonly known as hay fever. When the season strikes for these 36 million Americans, it's like having a never-ending cold.
I sneeze, cough. My eyes get kind of red and poofy.
I get runny nose and sometimes stuffed up.
Itchy eyes, drainage problems.
Or nasal drip down the back of my throat.
I start to wheeze.
The lungs would just seem to close up on me.
My sinuses explode.
Itchy, watery, ruddy, blow my nose. I'm major pain.
So what's causing all the problems? Arborist Bruce Carney took me for a little nature hike to show me what it is outside that people are allergic to. It's pollen.
So the stuff we're walking on is pollinating right now.
Right. The clover is actually producing pollen, and the grass has to get to a certain length before it produces pollen. But grass is one of the offending villains of the pollen world.
He showed me different grasses, weeds, and probably the biggest offender of outdoor allergies, trees.
So what kind of tree is this?
This is a red oak cat.
Believe it or not, our little nature hike ended up being a lesson in sex education.
And the pollen is produced on the male reproductive organs, which are called the anthers. And they're tiny
Wait a
microscopic.
minute, you said the tree has male reproductive organs?
Yes, a lot of plants have both male and female parts. Usually the male's above the female, and when it
This
floats
is
down,
really a family show.
Oh,
You
it is.
gotta be careful.
it is the pollen that causes the allergic reaction.
Oh my gosh, so in order for the trees to continue, we're gonna have to keep putting up with allergies,
Absolutely.
it sounds like.
Pollen causes misery for millions. But it also maintains life for many different species of plants. At the height of any allergy season, the air could be teeming with pollen. As a public health gesture, a network of over 500 allergists throughout the country voluntarily count the pollen so allergy sufferers can be warned. In Salem, Massachusetts, they use this device to catch the pollen. 2 greased glass rods spin for 30 seconds every 10 minutes and ensnare floating particles. At the end of a 24-hour period, medical technologist Laurie Nelson collects the rods and starts counting. Believe it or not, she counts them by hand, one microscopic pollen at a time. These offending allergens are Timothy grass pollen. These are ragweed pollens. And these are birch tree pollens. Looks pretty harmless to me, but let's take a closer look. About 1,000 times closer, or even 10,000 times closer.
During tree season, you can have a rod that is covered with pollen. This past May, we had a count of 4,000 pollen grains per cubic meter of air circulating in the air. This is what people are breathing in, and that is actually a health alert.
For outdoor pollen allergies, avoidance is the best remedy. I'm about to show you what happens if an outdoor allergy sufferer can't get indoors. It's something you've probably never seen before. Dr. Salah Salman at the Massachusetts Eye and Ear Infirmary is about to take a trip up the nose of longtime allergy sufferer Chris Geddes. Wait till you get a load of this.
I want you to breathe from your mouth.
Oh my gosh.
So you don't fog my lens as I go in.
You are now inside of Chris's nose. It's the first line of defense against any particles in the air. All of these cracks and crevices are there to prevent dangerous particles from reaching the lungs.
Just in the center of the field now is the area where some of the sinuses drain, and I see these are open. So I'm glad to say that your examination does not show any acute signs of swelling.
Well, doctor, can you put that back up his nose for a second? I want to ask you, I'm sorry. But wait, I want to ask something about your nose. I want to ask what it would look like if it was inflamed. Okay. I'm sorry.
Great. All right. Now, if this were inflamed or allergic, this thing will be very swollen.
Right, this would be.
All this would be swollen, and you wouldn't see the spaces around it.
So if he were having hay fever, all of this would be
swollen, yes.
This is ground zero for hay fever sufferers, where pollen meets the nose and the immune system overreacts. Gesundheit. Inside your home lurks a whole other world of allergies.
Hi, nice to meet you.
Nice to meet you.
Wow, we're gonna see some exciting things today?
Lots of creepy crawlies.
Ooh, I don't know how exciting that sounds, but I want to see them anyway.
All right.
Which way?
Be brave.
Jeff May is the author of My House is Killing Me. He wrote the book after collecting hundreds of air samples from allergic people's homes.
What's this right here?
That's a cladosporium.
Ooh, wait, what was that?
That's food. That's a big chunk of food that's all stored.
Here's a blue fiber from something.
That's a mold spore there.
Oh, what's that right there?
Part of a foam pillow.
Most of what Jeff's air samples reveal is dust. And believe it or not, most of what makes up dust is us. Well, actually, our skin. Our dead skin. Those big pink things you're seeing right now, you got it. Shed pieces of dead skin.
You lose about 30 grams of skin a month. It's constantly sloughing off your body, and then they get into the air. So if you're sitting in the movies and you look at the beam of light, you see all the dust, and that's all the skin.
Oh, don't tell me that's skin.
Sure.
Oh,
from everybody in the room.
Really gross.
So if there
I'm
are
never going to the movies again.
Come
and
on.
I'm covering my popcorn if I do. That is really gross.
If there are 1,000 people in the theater, then you have if you're sitting there long enough, you'll have every skin scale in your nose.
So is this a clump of stuff?
Yeah, that's just a clump of skin. See there? If you look, that's all skin scales. That's basically from a mattress.
And in mattresses live one of the major players of indoor allergies, the infamous dust mite.
Well, I keep hearing dust mites, dust mites, dust mites, and I haven't seen a dust mite yet. Where's a dust mite?
You sure you want to do this now?
I am. Don't you want to see a dust mite?
Okay, now that's the
food.
That's actually the food. That's right. And those holes, I thought when the first time I saw
there's something moving in it. Oh, no. I saw a bug moving. Ooh.
Wait, no, it's two. No, sorry, it's two of them. I'm sorry.
No, I can't look. I can't look.
It's
No,
two
I
of
don't even look. I just don't even
It's
want
two
to
of them.
I guess I really didn't want to see a dust mite.
Yeah. Oh my, there's like tons of stuff moving in there.
But here they are in all their glory. They're 8-legged creatures related to the spider, and for the most part, you need a microscope like Jeff's to see them. Millions of dust mites live in our beds, couches, and in our favorite easy chairs, thriving on moisture, heat, and a source of protein. Well, folks, guess who's supplying the protein?
The minute you get into bed, the moisture and the heat from your body probably is a little bit of a signal, and then they sort of all come, they wake up. In other words, we go to sleep, and then they wake up and say, you know, hey guys, come on, let's go. It's time to eat.
So they're just crawling around my bed, eating my skin.
That's right.
But it's not the actual dust mite people are allergic to. It's their feces, or more specifically, a protein in their feces.
Now that actually, in the middle of that hole, that's probably a fecal pellet right there.
Oh, okay. That looks really tiny.
Yeah.
And that's what causes all the problems.
And that's what causes all the allergies, yeah.
That little tiny thing.
The tiny dust mite. He lives in our beds, eats our dead skin, and causes terrible allergies. Today, Jeff May is helping allergy sufferers fight back.
Hi, Julie.
Good morning. Hello.
Yeah. Jeff May.
Nice to meet you.
Nice to
He's
meet
been
you.
called to Julie Dion's house to try and discover the source of her 3.5-year-old son Mitchell's illness. At first glance, the house looks immaculate, but Jeff, a severe allergy sufferer himself, senses something immediately using his most trusted tool, his nose.
I can go into an environment and then take a sniff, and often, you know, it'll bother me. So when we arrived at Julie's house, I noticed the smell in the house, and that alerted me to a little bit of a problem.
Jeff samples every room of the house, the carpets, furniture, and air ducts.
This is usually the most disturbing thing for people when they see all the dust that's here. And what happens, this is the return air for the heating system and for the cooling system. And the air with all the dust gets sucked in, and then it sticks over here. And if you look inside, you can actually see there's construction debris in there as well. Now,
What is that?
well, you won't believe it. It's all the dust from the house that's collected there. It's pieces of clothing. Did you ever notice when you shake something in the sunlight, you get little bits of dust flying off? And that's all the dust that's in the air that's collected. And dust mites like to eat that.
Oh.
That's dinner for a dust mite. Doesn't look very appetizing to me.
What's a dust mite?
Ooh, you're gonna have
Trust
to show
me,
you a
kid,
picture of a
you
dust
don't want to know.
I don't have one.
In the basement, Jeff discovers major problems. First, metal is rusting on the ceiling, which means that moisture is present. Then he finds mold.
This piece of furniture here is completely covered with mold. You can see this sort of blue-green color there and the colonies here and, and down in here. So it looks as though this piece of furniture got wet.
It did. In fact, it was under the window there.
Right. Now, was it upside down?
Mold is a fungus that thrives on moisture.
So a piece like this.
It's also a major indoor allergen. Jeff then spots a problem that could affect the entire house.
You see, there's a large gap in here, and that would allow air in from the basement, and that would be unfiltered air. So
The air conditioner could be blowing mold throughout the entire house. With a small air sampler, Jeff tests what's running through the air conditioning system.
See, it's bugging me.
I knew as soon as the blower turned on that the air was bothering me, but
Wow. My doctor says I shouldn't be doing this.
Back at his laboratory, Jeff discovers that almost every one of his air samples shows an extreme amount of mold spores. He finds cladosporium spores, penicillium, aspergillus, and stachybotrys.
what was very unusual was that there was a lot of stachybotrys mold spores in the air, which are potentially pretty toxic.
but it's rare to ever find it in the air in a building. So, I mean, I might find 1 or 2 spores in one air sample, and I think there was probably, 30 maybe or more.
The mold that is floating through the Dion home is probably what's making Mitchell sick.
If there's a 7-foot sign around a hazardous waste dump, there should be a 50-foot sign around, Mitchell's carpet to tell him not to be in there.
So how bad is this?
Well, I mean, if you had to breathe air like this day in and day out, you'd be a respiratory cripple.
This is a sick house, huh?
I would say so. It's a sick house.
The amount of mold found throughout the Dion home is extreme, so they must take extreme action. Julie calls a specialty cleanup company. These guys don't fool around. Dressed in protective suits and filtered respirators, they're trying to eradicate the allergy-causing mold. The air conditioning system is cleaned and sanitized. And the contaminated carpets are removed.
Ripping up a carpet, it's not rocket science, but removing it without spreading contaminants through the rest of the indoor environment is very, very difficult. And the work really needs to be done under what we call negative pressure containment conditions.
Controlling the airflow ensures that no mold spores can fly up and contaminate the rest of the house as the carpets are removed. Hopefully, these drastic measures will help ease Mitchell's health problems. But for most people, there are simpler and cheaper ways to heal your sick home. To prevent mold from growing in your house, the key is reducing moisture. Fix any leaks on your roof and seal all of your windows. Inside, keep humidity levels below 60%. A dehumidifier helps. In the bathroom, install a vent. And always allow shower curtains to dry completely, or else this could happen. But mold is only part of the indoor allergy story. If you're allergic to dust mites, you probably want to attack the bedroom first. And for this, you're going to need to do a little shopping. I'm at a specialty store with the allergy sufferer specifically in mind.
Nice to meet you. Welcome to Home Environmental.
Thank you. You must be Susan.
Owners Bill and Susan McTye are giving me the lowdown on all of the products you need to get rid of allergens in your home, like the dreaded dust mite.
The one that has the biggest bang for the buck, so to speak, is the bedding covers.
Bedding covers act as barriers. They starve and kill dust mites by denying them their much-needed protein, our dead skin. The bedding also traps allergens like the dust mite fecal pellets inside the pillow. So when you're sleeping, you're not breathing in dust mite feces.
Let me show you that. See this little urethane film? That stops the little guys from getting in and out, and also stops the allergen. There's a lot of testing involved to qualify a product for that.
This sounds noisy. I think I would hear this when I was sleeping.
Well, fortunately, there's some newer materials.
Susan was very happy to show me the newest type of bedding cover.
There are a lot more choices now for the consumer. It is much quieter.
There are new, less plasticky synthetic materials that are weaved together so tightly that it creates a dust mite barrier.
So it's quieter, it's more comfortable, and it's beautiful. It's luxurious and a nice feeling one, too.
Well, just so I'm clear, would I put my sheets, would I use this as a regular sheet, or would I put my sheets over this?
You would put this directly on your mattress or directly on your pillow and zip it up, and then you would put your bedding, your either a bottom sheet or if in the case of a pillow slip on top of it.
For someone who has really bad allergies, if they put the bedding on, how soon after they put the bedding on will they notice a difference?
We have people that overnight are for the first time in years, wake up symptom-free after just putting the bedding on.
Really? Wow, I want to see something else. What else you got?
There are dust mite-resistant pillows, special electrostatic dust cloths, and the all-important HEPA vacuum cleaners.
What is a HEPA filter?
A HEPA filter, HEPA stands for high efficiency particulate arrestants.
I bet you can't say it again.
High efficiency particulate arrestants. But the bottom line is that the air coming out of here is cleaner than the air you're breathing right now.
Oh.
All vacuum cleaners have an exhaust. Most non-HEPA cleaners take in dust and spit a lot of it right out the back. Not a vacuum with a HEPA filter. Watch this. Bill has a special device that counts the amount of particles coming out of the vacuum's exhaust.
This is an old vacuum, very old. I can even smell.
I can smell it too.
Yeah, okay, that's very important. I'm measuring 1.5 million particles per cubic foot coming. Oh, it's up to 2.2 million. Now, that's not very good.
What's a standard amount of particles? I mean, if this is up at 2 million, what should it be, like reasonably?
Well, closest to 0 as possible.
Next, we tested a vacuum with a HEPA filter.
Turn on the vacuum. And again, it takes 6 seconds to update, but we'll watch the particles count down here. 3,900, already less than either of these.
Yeah.
100. So
That's
as you can tell,
nothing.
yes, you can tell this is a very good vacuum.
Wow, that's a big difference. But what about the air cleaner?
Air cleaner, again, uses that same technology.
Air cleaners are great if you have mold allergies. They suck up and kill most airborne mold spores.
Nice and quiet, we like that.
Just look. Down to 0.
Oh my gosh, that means it is pure air. That's amazing. Thank you. Okay, so we figured out how to avoid outdoor allergens, and we figured out how to reduce indoor allergens. But what do you do if you still have allergies?
If you have allergies and want short-term relief, it may mean a trip to the drugstore. There are literally hundreds of over-the-counter and prescription medications that you can take for allergies. These are decongestants. They relieve runny noses by stopping the swelling in the sinuses. There are also antihistamines, which counter the histamine released in the allergic reaction. Antihistamines relieve itching, sneezing, and nasal discharge. There are also combination decongestant antihistamines that take a 1-2 punch at the allergic symptoms. But be careful.
And if you look, most of us don't read packages, but if you really read them, this one says, if nervousness, dizziness, sleepiness, discontinue use, consult a doctor. If you have heart disease, high blood pressure, thyroid disease, diabetes, difficulty urinating due to enlargement of the prostate, don't take it. Another side effect is sleepiness. It can make you very drowsy, and now a lot of these sleep pills, the over-the-counter sleep medicines, use an antihistamine as their active ingredient.
To remedy this serious side effect, drug companies have produced a new generation of antihistamines with a non-drowsy formula.
The newer pharmaceutical antihistamines cause much less drowsiness than the older ones. So from 5-10 years ago, it's like night and day. 10 years ago, if you took one of the older antihistamines, some people would be out for the count for the day. Now, very few people have a severe drowsiness problem.
No matter how bad your allergies are, check with your doctor or pharmacist before taking any medications. "14-year-old Michael Costa may have found a remedy far more effective than anything he could buy at a drugstore. Michael's tree pollen allergy once kept him confined to his house for most of the allergy season.
There would be days where my dad would just have to drive me on my paper route, have the air conditioner blow on my face, and it was tough.
But last year, Michael began receiving the most powerful long-term treatment an allergy sufferer can get: allergy shots. Every week, Michael receives an injection of a very small dose of pollen allergen. The dose is so small that it does not create an allergic reaction. Over 3 to 5 years, the shots sensitize the immune system, in effect, teaching it that the substance is not a dangerous invader. For Michael, the shots have had a dramatic effect.
I wouldn't be able to be delivering the papers if I didn't have the shots.
Michael Costa's father is also undergoing desensitization shots. He's allergic to bee stings, so allergic that the next time he is stung, he can go into anaphylactic shock.
Michael Costa is now on venom desensitization, tolerating shots very well, and he is effectively protected. After 5 years of treatment, he will be effectively cured.
In addition to Michael's father, his brother Kevin is also getting allergy shots. The shots require a long-term commitment, and they aren't always completely effective. But they can offer what every allergy sufferer craves, the possibility of a cure. This is Susan Lanine and her son Brad. As a young child, Brad had trouble keeping food down and was losing weight at an alarming rate. At the age of 4, he weighed only 32 pounds.
Right away, I knew I had to do something because this boy was physically dying. He was dying.
Brad was diagnosed with food allergies to bananas, wheat, dairy, chicken, pork, and beef. Food allergies affect over 6 million people in the United States, and often the only way to treat a food allergy is avoidance. Simply don't eat the offending foods. Susan bought several health food cookbooks to make Brad allergy-safe food, but she quickly discovered that her son would not touch the unappetizing meals.
The children will not eat them. They taste disgusting. They're just not going to eat them. They look at me with 3 eyes. I am not eating this. So I just had to take it upon myself and use the brain that God gave me and start cooking and force him to eat, or he wouldn't be here.
So Susan started to create her own recipes.
I was just experimenting in my kitchen. I had brown rice left over, and I put it in the blender with some Ensure, chocolate Ensure, and I added some oat flour to it, and the semi-sweet chips from the health food store, and just started experimenting, and I baked it, and it came out, and they taste just like box brownies. So it was just a fluke that this concoction worked. Okay, kids, are you ready? Yeah.
Susan created unique dishes for her son, like steamed apricot bread, oat rice waffles, and mashed potato candy. What began as a survival guide for Brad has evolved into a kid-tested food allergy cookbook with over 200 wheat and dairy-free recipes. Food allergies don't just limit your diet, they can also kill you. Every year, around 100 Americans die from eating the wrong food. 7-year-old Rosemary Mulligan has severe allergies to all dairy products, eggs, most nuts, avocado, and lamb. When she was 3, Rosemary's mother, Pat, mistakenly fed her formula with milk in it.
Suddenly, she grabbed her throat and she started screaming, "My throat, my throat!" And she started running around in circles, my stomach, and she began to bark with this very hoarse, kind of croupy cough, and she began throwing up.
Pat then noticed a rash on Rosemary's chest that quickly spread throughout her entire body.
And her eyes rolled in the back of her head, and she fell off the chair. And within 3 minutes, we were in an ambulance headed to the hospital.
Rosemary was experiencing the most extreme allergic reaction, anaphylaxis. Her blood pressure plummeted, depriving her body of oxygen. To save her life, doctors treated Rosemary with a life-saving drug that raises blood pressure. It's called epinephrine.
Epinephrine is known also as adrenaline. It's a naturally occurring compound made by the adrenal gland that serves to increase blood pressure. So if someone's having a severe anaphylactic reaction characterized by a drop in blood pressure, injection of epinephrine reverses that, and it does so quickly. It works within minutes. So it's the first drug you would use.
Today, wherever Rosemary goes, she wears a medical alert bracelet and carries a one-dose injection of epinephrine called an EpiPen.
I carry EpiPen and Benadryl, and I carry 2 pieces of paper that say what I'm allergic to, and how the EpiPen needs to be given.
Rosemary has already had 6 anaphylactic reactions. Today, they're teaching Rosemary's friend, Timmy Weberson, how to administer her life-saving dose of epinephrine.
Be careful, because this is a real EpiPen.
To give an injection, the EpiPen is pressed against the upper thigh. When pushed, a syringe pops out of its casing, delivering a single dose of epinephrine.
You guys count together?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Pull it up. It's over, it's over, it's over. Is that what we say?
Yeah.
The EpiPen is just the first step. An anaphylactic reaction is a medical emergency, so call 911.
Let me give you 5. You know, I go through life saying to myself, we're going to try to prevent the next reaction. But in the back of my mind, I know it's coming, and that we all have to be prepared.
Many allergies you get by inhaling or ingesting allergens. But there are some allergies you get simply by coming in contact with them.
So they can eat the seeds, they can eat the leaves.
Arborist Bruce Carney is taking me on another nature hike. This time, he's going to teach me how to avoid something that I don't want to touch.
So is this poison ivy?
This is poison ivy, Kat. These 3 multiple leaves, or we call them compound leaves. The 3 leaflets make up 1 leaf, and they're red, or slightly red when they're young, and they're dark green when they're older. Poison ivy.
Wait, which is the poison ivy?
You see, it does also grow up trees. This is all poison ivy again.
They ought to call this place Poison Ivy Woods. It's everywhere.
It is everywhere. On the surface of the leaf is little canals that hold this oil, and the oil is a compound that's a combination of different substances called urushiol, and that, when it gets on your skin, it actually penetrates the skin, and that's antibodies are produced, and that's how you get the allergic reaction.
So what type of precautions do you take to stay away from it?
Recognize it, know what you're dealing with, and unfortunately, I keep soap in the car or the truck, and I wash my hands thoroughly after every job, just in case.
So if you think that you've brushed up against poison ivy, the best thing is immediately wash, and so you might be able to avoid a really bad reaction.
Right. You might get a small one, which is bad enough, but if you leave it on there untreated, you will get a severe reaction.
What about just like rubbing the area with alcohol?
Alcohol's good. It dries up, breaks down that compound and dries it out. So that's very good. There's a good example of how thick it can get. Look at the size of this root.
That is a poison ivy root?
Any part of that can give you poison ivy.
That is like something out of a horror movie.
It is. Looks like a thick rope.
Now I see why people get it and they don't know, because I'm sure people would maybe try and stay away from the leaves, but they wouldn't know to stay away from this.
You just brush by that, it has the oil on it, you're done.
Hey, you better be careful. I see a lot of ivy around your legs there.
Poison ivy is the leading allergy in the United States. 3/4 of the population, or over 200 million people, suffer.
Since the mid-1980s, more and more people, especially healthcare workers, have become allergic to a substance that, ironically, is used to save lives.
I've cheated death over 20 times with this anaphylaxis, and it's a very scary thing. There's nothing like it. Anybody that's anaphylaxed will tell you that it feels like you're going to die.
So come on in, Christine.
Okay.
While working at a hospital, Christine Costa, a certified nursing assistant, came in daily contact with the substance that is responsible for the fastest growing allergy, latex. Latex is natural rubber and is used to produce hundreds of medical devices, including tourniquets, IV tubing, blood pressure cuffs,
just breathe normally,
oxygen masks, and of course, latex gloves. A nurse may sometimes wear 60 pairs of gloves per day.
Just look at your eyes for a minute. Put your chin down a tiny bit and then look up to the ceiling for me.
After suffering red, itchy hives on her hands, Christine's allergist, Dr. Aidan Long, diagnosed her with a latex allergy, so she stopped wearing the gloves. But unfortunately, that didn't stop her allergy because her coworkers kept using them. Every time they snapped on their latex gloves, they sent a fine powder full of latex allergen floating into the air.
In spite of the fact that I myself stopped wearing powdered latex gloves, my coworkers were wearing powdered gloves, so I was being, zapped by the aerosolized powder as they would remove the gloves, and it's my understanding that the powder can actually stay in the air for 10 hours.
With every exposure, Christine's allergies worsened. It is a common phenomenon. Each repeated encounter makes the immune system more and more sensitive. Finally, Christine's health hit bottom.
The reaction that made me leave the hospital environment was a routine recertification for CPR. And unbeknownst to me, the Recessi Annie mannequin was rubber. And the ironic thing was, as I was doing the chest compressions and the mouth blows to the mannequin, I completely hived up. My throat closed, my eyes swelled shut, and my peers, a close friend that knew that I had the latex, put it together, gave me my epi, threw me in a wheelchair, and got me to the emergency room.
Okay, we're in. Balloon.
But here's the problem. The emergency room is filled with latex products.
All right, let's take a listen. Sharon, can you listen as well, please?
For most patients, this is the first stop to recovery. But for the latex allergic, it could be their last.
When you have a latex allergy and you have to make that 911 call, it's a whole different ballgame because you're being brought to a place that can quite possibly kill you while they're trying to save you.
Since 1970, latex has sickened hundreds of people and killed at least 15. Christine has an extreme case of latex allergy and was forced to give up her nursing career. But probably the most painful moment for her was when she learned that she would have to deliver her third child by cesarean section and enter an operating room.
It was terrifying. I remember telling my husband that I was in fact pregnant, and we just cried in the kitchen because I knew, anytime you go into an OR setting with a latex allergy, even for childbirth, it's a dangerous place to be.
Today, many hospitals are acknowledging the growing latex problem and have a special cart with latex-free equipment. But for Christine's severe allergies, that's not enough. So Dr. Long arranged for a special operating and recovery room that was as latex-free as possible. Christine arrived at the hospital in terror, but gave birth to a healthy baby boy. Luckily, mother and son left the hospital safely. Christine's supportive family is a window into the nature of allergies. Her son, Michael Jr., the paperboy, has severe pollen allergies. Her husband, Michael Sr., is allergic to several different foods, pollen, and stinging insects. Christine's other children, Kevin and Amanda, also have pollen and dust allergies. This isn't just a coincidence. Scientists believe that allergies are genetic. If one of your parents has an allergy, you have about a 30% chance of developing one yourself. If both of your parents have allergies, the chances of becoming allergic may be as high as 70%.
Most people who suffer from allergies take the traditional approach to remedies, but for some people, they follow a different path.
Like Carrie Lewis, who is looking to alternative medicine to help her with severe pollen, ragweed, and cat allergies.
It was difficult to get out of bed in the morning. I was very tired, couldn't breathe at all, and my eyes would get puffy and runny and actually swell shut sometimes.
So you just didn't have like the sniffles and the sneezing?
No, I have violent allergies.
Carrie's been on prescription antihistamines for years, but now she wants to beat her allergies using natural remedies.
My real goal is to get off of any antihistamine medications. So I'm pretty much willing to try anything.
Carrie is now seeing Shiva Barton, a naturopathic doctor. Surprisingly, Dr. Barton treated her seasonal allergies by examining the food she ate.
In naturopathic medicine, it's a holistic approach. We take into account nutrition, and that helps us to find out the underlying cause of your allergies. So we remove the foods that you're allergic to, it decreases your inflammatory chemicals, and you feel better. Your allergies, like your inhaling allergies, improve.
Dr. Barton tested Carrie for low-level food sensitivities. In contrast to Western medical theory, naturopathic doctors believe that these sensitivities can worsen respiratory allergies. By eliminating problematic foods from her diet, Dr. Barton hoped that Carrie's nasal allergies would subside.
I reacted to pretty much everything I eat in my regular diet.
Like what?
Wheat, dairy, glutens, which is all grains, corn, potatoes, chicken, pork.
What do you eat?
Well, for 5 months I ate a lot of fish, a lot of rice, started eating a lot of soy. So I ended up being forced to eat very healthy.
In addition to a strict diet, Carrie is also taking herbal remedies. Dr. Barton recommended flax oil, which he says is a natural anti-inflammatory, and quercetone, which may strengthen immune cells so they won't readily release their histamine. Finally, in an effort to strengthen her overall vitality, Carrie receives acupuncture. It is believed that needles in the ankle, shin, arm, and even the face help with respiration and sinus congestion. Some believe that acupuncture will give the body greater strength to fight allergic symptoms.
And actually this spring, for the first time in at least a decade, I've not taken an antihistamine.
That's great.
Carrie Lewis's success shows that there are alternative ways to try and beat the nagging symptoms of allergies. Allergies are a cruel mistake, but there may be something even crueler. Allergies are on the rise, and scientists aren't sure why. One theory is that we're victims of our own success.
One reason why there may be an increasing prevalence of allergy may relate to the decreasing number of infections we all have to fight, particularly in early childhood. Increased levels of hygiene, decreasing frequency of infectious disease, increasing use of antibiotics. Mean we're fighting infection less than we used to, and this may in turn be allowing the prevalence of allergy to emerge.
We now have ways to fight allergies. We can carefully gauge the pollen in the air. We can make our houses safer and create allergen-free meals. We can also get desensitization shots or even try acupuncture. But for now, the best plan is avoidance because allergies appear to be here to stay.
Allergies are on the rise. Unfortunately, we don't fully understand why. But whether you're allergic to food, pollen, dust mites, latex, or cats, an allergy can be aggravating or even deadly. Hopefully, scientists will one day better understand what causes this common health misery and how to cure it.